EDS doesn't care that you're exhausted. It doesn't care that, you know, I was in a class this semester. Hey everybody, welcome to another vlog, I guess. I had an appointment with my pain doctor this morning, and it went well. We kind of talked about what's going on in my neck and the rest of my back. And then, let's see, he examined me and now my head and neck are really angry. So I just had to stop and run an errand and then I'm gonna head home. But it's been frustrating for me, I think, it's not surprising, but with EDS, it's like nonstop. It doesn't matter what's going on. It's one thing after another. And realistically, a lot of times it's several things at once, but you have to kind of prioritize, and then, you know, you cross one off the list and then the next one has to be addressed, and it just goes on and on and on, it seems. So I don't know, I'm just frustrated because we talked about, like, would I go through with some sort of spine surgery if it shows that I have instability in my cervical spine, and at this point I'm not entirely sure. I feel like it's important for me to see imaging and kind of get an idea of what exactly is going on. If there's like severe instability, then I don't feel comfortable walking around like this. But I also have had many spine surgeries and they are no joke. It causes issues above and below where they fuse, and I'm dealing with those issues as well now. So in my lumbar and thoracic spine. So I don't know, I'm just frustrated because it just doesn't stop. And I don't know, EDS doesn't care that you're exhausted. It doesn't care that, you know, I was in a class this semester. It doesn't care about any of it. Yeah, I don't know, I'm just really frustrated. So it is, by the way, it is literally 79 degrees here in LA, and it's, what is it? It's like March 5th or something. It's insane. It was 90 degrees like last week. I don't like the heat, so luckily I have good air conditioning in my car. But yeah, so I don't know. I'm gonna go home now and rest a bit. I was sick yesterday, which is really weird. I like woke up at 2 in the morning with, like, I was coughing so hard I was gagging in my sleep, and obviously eventually woke up. And was sitting up for a while so I didn't completely throw up. But then I, like, as time went on, my temperature kept increasing and it was super weird. I felt horrible. I felt like I had been hit by a Mack truck, like my entire body just hurt really badly. I had a really bad headache. I had really like intense like sinus pressure, which I kind of still do. But when I took a deep breath, my lungs were like rattly almost. They like kind of rattled. I don't know if rattly is a word, probably not. And yeah, I've had pneumonia several, 2 times, I think. And it feels like that, where my lungs they like make noise when you breathe. So, but yeah, then like at I don't know, 8 o'clock last night, my temperature went away, and actually my temp went really low. And then today, like, I feel fine. My throat hurts a bit. I still have quite a bit of sinus pressure, but I don't know, it was super bizarre, which is a good thing because I had to email my cardiologist and make sure that, just ask what I need to look out for in terms of, gosh, it's so hot. Basically in terms of having my, since I'm post heart surgery, it's kind of difficult. If I get any kind of infection, like especially systemic, it can be really dangerous. So I emailed her to kind of find out what exactly that, like what I would need to watch out for. And she basically said if it's anything bacterial, it would definitely, more than likely, I guess she said it would affect the heart. If it's viral, usually it doesn't. She told me to watch for my port, particularly to make sure like it's not getting infected, because if that got infected and then I got sepsis, that would be problematic for my heart. So yeah, I don't know. I'm just glad that I feel better today, and hopefully it doesn't. I've had this happen where like I have a decent day and then I get hit like really hard. So just hoping that doesn't happen. I'm gonna go home. I'm so hot. I'm clearly like overdressed. I'm wearing like a sweater. I'll see you guys later. Okay, so I got home and this lighting is terrible, but I need to take some medication, and I thought I would show you how I crush my meds and put them through my feeding tube. So here we go. So first I put the medication in my pill crusher. It's goes in there. And you can see here on the bottom, I don't know if you'll be able to see it, but as I crush this, I need buttons. As I crush the medication, a little powder should be coming out on the bottom. Yeah. This is only one pill, so it's not a lot of powder, but at night, for example, and in the morning I do, I don't know, like 10 meds or something at a time. Alright, so that's done. Should be able to see that in there. Okay, mug, purified water. I don't have to use purified water, but I don't drink tap water, so I figure I wouldn't put it through my tube either. I need a new extension set this week. Mine is getting pretty worn out. I get a new one of these every week. It like connects to my feeding tube. So if I'm not connected to this, it's pretty small. I mean, you can still see it, but it's a lot better than when this is hanging out. So I microwave this for 30 seconds, actually. Oops. And I need to take out water first. Because I don't want hot or like warm water to go. Also, when I flush, I get really hot when I do that. So I use this little thing that I got like a while ago at, I think it was at like Big Lots or something. It's anchor hawking, but it looks tiny, but it's actually, it holds like a lot more than it looks like. Okay, so I pour the powder in here. Make some of this warm water. Okay, so I have this stuff with me. So the med is right in the orange, and then the water is here. That's just to flush it. Also, trick, keep washcloths around if you have a feeding tube. I use them for like everything. Okay, so there's the tube. For those of you who have feeding tubes, I'm sure I'm gonna get questions as to why I don't use tubie pads. Tubie pads, for people who don't know, are, here, I'll show you what they are. They're these like cloth disc things, and they go like around the feeding tube, and they just kind of sit there. And feeding tubes, some like stomach acid comes out of the incision or stoma, and people like to use these. I use gauze instead, and the reason is my GI doctor does not want me wearing tubie pads. He said that warm, moist environments and dark environments are great for breeding bacteria or yeast or whatever, so he does not like me using them. So I don't use them at all. I actually find them uncomfortable. I find either having nothing under there or having like the gauze, which is what the home health company supplies anyway. Extension set. Okay, so now flush it. Oops. I always shake it because the powder can kind of get stuck on the bottom. I flush it with the little bit of water left. Right. So now I'm just gonna relax in bed for a little bit. My neck is pretty pissed off. He pretty much did what my physical therapist did, which was like have me move my head forward and backwards. So I think flexion and extension, I think. And he could feel in my like upper cervical spine that there's more than likely instability. So yeah, and then I'm having my MRI tomorrow. I don't know if I already said this, but I'm having an upright MRI with flexion and extension, which basically allows them to see how everything moves when I move forward and backward and just in a neutral position, but it's sitting up. So normally MRIs are lying down, and the reason we don't do that, some doctors do that. However, for EDS patients, a lot of the problem is when we have gravity working against us. So if I'm lying down, that's actually the position that relieves almost all of my pain. I mean, not 100%, but it helps. Sitting up, standing up, or walking is where I have issues. So it actually kind of makes more sense to see it exactly how I am out in the world. Otherwise, it's kind of, I don't know, just feels kind of not as accurate to get a full picture. So that's going to happen tomorrow morning. We are also going to probably add one other test as well, and then we'll go from there. There's a surgeon up in Northern California that I'm trying to get in to see. Well, I currently have an appointment with him, but depending on what my MRI shows, he may want to squeeze me in sooner, so we'll see in the next couple days what happens. But yeah, I'm going to rest for a while. I'm tired. I've been resting for a few hours, and now I'm going to sit up while I'm resting. Haha. I've been on the phone pretty much the whole time, calling medical things, dealing with neurosurgeon, etc. But so I bought this pillow the other day that I bought at Bed Bath & Beyond, and it's like a memory foam cervical whatever pillow. It is the worst pillow thing I've ever used. It's horrible. So luckily I had a pillowcase on it, but I'm gonna be taking it back because, I mean, it was so bad. Made my pain like way worse. Versus like I have another kind. It hasn't done that at all. Cervical pillows are kind of weird because they do require a bit of an adjustment period, and that's okay, but it was so bad that I couldn't handle the adjustment period. Also, random fact, I used to actually work at a yarn store when I was like 12, 13. I was taught how to knit by both my mom and my stepmom. I learned like, different techniques from both of them, and I used to knit like a scarf a day. So eventually my parents had me try harder things because I was going through so much yarn. So I started doing sweaters and different things, and then knitting was super in. This was like early 2000s-ish. Became this huge craze, and there were all these knitting stores like all over the place, and it was a lot of fun. I loved it. I taught lessons and changed people's mistakes if they made a mistake or whatever, so they wouldn't have to start all over again. And the irony is I can't remember how to cast on. So pathetic. Which is just like starting a project on a knitting needle. So I'm gonna Google it and I'm sure it'll come back. I did a little bit of knitting. By a little bit, I mean a tiny bit. I got distracted and ended up watching a YouTube video. But I need to go return something. I live in walking distance to a bunch of different stores, so I need to go return something, and I'm having my MRI tomorrow morning, and I'm trying to keep my activity level closer to where it would normally be if my like back and neck were not flared, so that we can try to get hopefully the most accurate results based on kind of how I do once I am more active, versus what I really want to do is lie down because I'm in a lot of pain, but gotta push through so we can hopefully get some answers for what's going on.